Hello, this is Dr. Tulipo Mwenfumo. I'm coming again, once again, with an interesting subject entitled Abnormal Psychology. This course is going to be taken, or the main textbook that we are going to use is Abnormal Psychology by Dr. Tulipo Mwenifumbo. So you can order this book for you to have more understanding on abnormal psychology. This book is suitable for practitioners, and it is also suitable for students. This is your host once again, Dr. Tulipo Mwenfumbo. We offer varieties of courses from business courses, counseling courses, psychology courses, and many more courses. So you can, to register, you can WhatsApp +260 +260 975 30892, or you can WhatsApp +260 976 18 12 53 +260 976 18 12 53. Once again, this is your host, Dr. Tripo Mwenifumbo. Um, in lesson 1, we are going to look at abnormal psychology, and we are going to look at introduction to psychology, abnormal psychology. In introduction to abnormal psychology, we're going to look at course description and objectives. We are going to look at definition and history of abnormal psychology. Then we are going to look at classification and diagnosis of mental disorders. And we are going to look at overview of major categories of mental disorders. Now, what is this course all about? This course provides an overview of the field of abnormal psychology, including the definition, classification, and diagnosis of mental disorders. So, at the end of this course, students will explore the causes, symptoms, and treatment options for various mental health conditions, including anxieties, mood disorders, personality disorders, and psychotic disorders. So these are the things that we are expecting you to learn at the end of this course. So by the time we are finishing this course, you must be able to explore the symptoms and treatment, and various treatment available for treating the mental disorders. And you have to be able to understand different mental disorders like mental health conditions, anxiety, mood, personality disorders, and psychotic disorders. Um, the course objective are that you must be able to define abnormal psychology and its relevance to mental health. So remember, this course is all about mental health. So you have to be able to define it and also understand it in relationship to mental health. You should also be able to identify and describe the major categories of mental health. And also, you must be able to analyze the causes and symptoms of various mental health conditions. You should also be able to evaluate the effectiveness of different treatment options for mental disorders, and also apply critical thinking skills to case studies and real world scenarios. So you must be able to develop also uh, the desire, and also you should be critically be able to do the research on this subject, which is mental disorder or mental abnormal psychology. Now, what is abnormal psychology? When we talk about abnormal psychology, we are simply talking about the study of unusual patterns of thought, emotion, and behavior that may or may not be considered mental disorders. Um, we are talking about when we talk about abnormal psychology, we are talking about some emotions and behaviors that may be considered as mental disorders. So this subject has been developed over time. So the study of the mental disorder or the study of abnormal psychology dates back to ancient civilization with evidence of treatment for mental illness found in ancient Egyptian, Greek, and Roman Empire. So you can be able to get this more of this information in the book, which is Mental Psychology, the one that we are using as the textbook. So I've gone details in this book so you can be able to find the information that is relevant to this, where we have explored the Egyptian, Greek, and Romans texts on how they used to treat what is called mental illness. So the evolution of mental disorder or of abnormal psychology, we would find that abnormal psychology has been developed over time, and the treatment and other various perspectives have come up. So the field of abnormal psychology has evolved over time, influenced by various perspectives. So there have been a lot of people and gurus that have come up with the theories and the perspective of what abnormal psychology is. So the perspective of abnormal psychology, there are uh, different perspective, and one of the perspective is supernatural perspective. We understand that the supernatural perspective is the perspective which we consider to be spiritual perspective. So those people that believes in spiritual things, what do they talk about abnormal psychology? So they view mental illness as a result of demonic possession or divine punishment. So when you talk about mental illness, when somebody is mad or somebody has gone mad, so those that believe in supernatural, they'll consider that maybe to be witchcraft or to be a demonic possession, or to be a punishment from maybe divine punishment. Maybe God is punishing somebody, or maybe because somebody did something wrong and now he's being punished. So that's how they perceive uh, mental illness. So when somebody gets mad, they perceive that the madness is coming because of what this person may have done, or maybe because he has been witched, or maybe because he has done something that has caused that person to be punished. Then there is also what is called medical perspective. This view of mental illness is as a result of physical causes, or such as brain damage or disease. So those that believe in the medical perspective, they say that mental illness is as a result of illness or maybe brain damage. Then there is also psychological perspective, viewing mental illness as a result of psychological factors such as thoughts, feelings, and behaviors. So this perspective says that the reason for somebody to be mad or to have mental illness, it can be the result of factors such as maybe feelings, guiltness, and other things that may cause this person to be disabled mentally. So now there are perspectives on these uh, three perspectives of mental illness. There is what those that believe in trichotomas. The trichotomas are those that believe in physical, spiritual, and also mental. In theology, they say soul, spirit, and body. So those are they believe that mental illness can come from brain damage, or it can come from spiritual, or which is demonic possession, or it can come from psychological, which is because or maybe this person is uh, because of anxiety and other issues that may cause mental illness. Then there is the dichotomous. The dichotomous are those people that believe in physical and also they believe that there is only the soul and the body, which means that it is the mind and the body that can cause somebody to be mentally ill, and that is it can be caused by brain damage, or it can be of sickness, or it can be caused by maybe stress and psychological matters. Then there is also what is called monocotomous. The monocotomous are those people that believe there is nothing like supernatural, there is nothing like the mind, it is only the body. So that and the cause of illness, uh, it is biological, which is a brain damage or disease that can cause the mental illness. Then classification of as a classification and diagnosis of mental disorders. So we have looked at three perspectives. There is spiritual perspective, then there is a biological perspective, and also there is a psychological perspective. Now, what are the classification of diagnosis? The classification of diagnosis, mainly there are two major diagnoses classification of used in abnormal psychology. There is number one, which is diagnostic and statistical manual of mental disorder. And also there is ICD-11, which is International Classification of the Mental Disorder. And I'm going to also add, for the sake of those that are spiritual, which is spiritual the spiritual part of spiritual classification. So when you talk about diagnostic and statistical manual of mental disorder, a manual published by American Psychiatric Association that provides standardized criteria for diagnosing mental disorders. So there is a manual which is called DSM, which has been put in place, which has the diagnosis and the standard on how to treat what is called mental disorders. And there is also another one, which is ICD, which is International Classification of Diseases. This also has the guideline on how to treat mental disorders. This is a manual published by World Health Organization that provides standardized criteria of diagnosing mental disorders. And I'll also give what is the other one, which is the Christian perspective, which deals with demonic possession and or which is demonology. And this is also the other thing that when it comes to classification of disease and mental disorders. Now, let's look at this way critically. You may find that all these type of diagnosis of type of treatment has worked out. So now how do we diagnose the mental disorders? The process of identifying and labeling a mental disorder based on observed symptoms and behaviors. So diagnosis, it is when you have observed certain symptoms and you have come up with how that type of symptom should be treated. So, like for those that are spiritual, we have got three types of mental disorders. There is a spiritual, the biological, and also there is the psychological. So in diagnosing, you have to be able to diagnose. If you are a pastoral psychologist, you should be able to know where you need to refer to the physician who is specialized in biological mental disorder. And also there are those that are specialized in what is called psychological, and we are going to look at these. And also there is those that are specialized in spiritual disorders, where prayers are the only ones that can work. So that assessment is what is called diagnosing. So the assessment, there are various tools such as questionnaires, interviews, and observations are used to assess and diagnose mental disorders. So you can be able to diagnose by taking the asking questions, interviewing where these challenges come from, what happened, and all that. You'll be able to know whether it's a spiritual problem or it's a mental problem, or it's a biological problem, or it is the psychological problem. So there are overview of major categories of mental disorders. Let's look at some more of the mental disorders. So the following are just some of the major categories of mental disorders. There are many other disorders and categories within uh, uh, each category. So there is anxiety disorders, which is characterized by excessive fear or anxiety. So this is the psychological disorder. So in the psychological disorder, we are talking about anxiety, whereby a person, maybe it may be fear, maybe this person has been traumatized by something, and this person become challenged psychologically because of generalized anxiety disorder, panic disorder, and social anxiety disorders. It may be a lot. There are a lot of challenges that we face. It may be the fear of life. It may be maybe this person has lost the beloved one. It may be because of the shock. So there are different disorders within anxiety which may cause the person to have mental illness. Then there is mood disorder, which is characterized by disturbances in mood, such as major depression and depressive disorder, and bipolar disorder. So this is the disorder which may cause through maybe one has been abused, and because of the abuse, it creates what is called the mood challenges. Then there is also personality disorder, which is characterized by enduring patterns of thought, feeling, and behavior that divert from cultural norms, such as borderline personality disorders and narcissistic personality disorder. So now, because some of the beliefs and cultural understanding, they can cause some disorders because you have been raised in a certain environment which has got certain issues which may not be right to other cultures. So you may be looked as not being normal in that area. So that may be personality disorders. And sometimes it is because of the environment that one has been brought up. Maybe this person has developed fear, it doesn't have confidence. And others, they just become narcissists. So there are a lot of disorders which are called personality disorders. So to have more information on disorders, you can in details, it is found in this book, which is Abnormal Psychology, and you can find whatever that we are talking about. Then there is also psychotic disorder, which is characterized by disconnection from reality, such as psychosophria. Yeah. This is when we talk about psychosophia, yeah, it is as something that has to do with fear, or one which is uh, it creates that disorder that disconnects you from the reality. You are not looking at reality, you see things differently. Then there is trauma and stress related disorder, which is characterized by responses to traumatic incidences, stressful events such as post traumatic stress disorder and acute stress disorder. When you talk about acute stress disorder, it is after being somebody was critically sick, then he faces such disorders. Now, when you look at the how do we treat these disorders? So we say there are different treatment that can be used. There is a psychological treatment which we can be able to use when dealing in this disorder, whereby you can just use what is called counseling, and this person can receive the therapy that is necessary for this person. So a person you can use psychotherapy. When we talk about psychotherapy, we are talking about the the therapy where you do the counseling, psychological therapy. You counsel this person, you bring this person the to the understanding through probing and other counseling methods. Then there is also where now you can use medication. So medication is also used to deal with some of these disorders. Then we have got also you can use for those that are spiritual, you can also use prayers depending on the diagnosis. So you as a psychologist, you must be able to know which is which, and where you are not specialized in it, as a practitioner or as a professional, one thing is a referral is very important. So you must be able to refer where you see that you cannot be able to perform, or that you cannot be able to work on your client. So you can refer them to the psychiatric, you can refer them to pastoral or spiritual method of healing. You can refer them to also to psychology counseling. So all those can be treatment that are variable. Thank you so much. It has been a good time being with you, and looking forward to join me in the next class. So if you have not subscribed, I would want you to subscribe so that you may be able to receive information that is well sorted out. Thank you so much and God bless you. This is your host, Dr. Tulipo Mwenifumbo.